My name's Kirk Doering, and I'm with the Accelerated Nursing Program here at the satellite campus in Meridian, Idaho. I had previously been in the Navy. I previously an EMT paramedic. Also had worked at Plasmapheresis Center as one of their medical operations supervisors. And, the opportunity arose for me to be able to go back to school. And ISU, especially with that accelerated program, if you have an existing degree and you get selected for the program, there's not a more efficient way from A to Z. I mean, really, that's, especially the way that they set up the accelerated program. If you are, already in a career, you kind of already have your path laid out for you, and you just want to get in and get out. It's as efficient as any other program I'm aware of. I mean, it's a good deal on that side of it. Well, nursing is, I've been in healthcare for, I want to say close to a decade. And I've been on the EMS side of things for the most part. And I know a lot of doctors, I know a lot of nurses. I've had the opportunity to interact with a lot of different facilities. And, not to poo-poo being a doctor or an NP or a PA or anything like that. I mean, those are necessary positions. I'm glad that there's people that can do it, but I think that when you start moving up the chain of command in the medical side of things, you become it's a commodity, and it's how much time do you have to interact with a patient. And the further up the chain of command you are, I think the less time you have to interact with patients. And I love talking. I mean, being a nurse is, I think, one of the few professions left where you truly can get paid to talk with someone. I mean, sometimes that is the important part, is to talk to a patient, find out what's going on. You never ever meet a patient on their best day. They're there because something has gone wrong. Something got broken, something got infected, something's hurt, right? And if you can walk in and talk to them and help them turn around and, take that day that ended it the worst way it possibly could have and start it going the other direction, I think that as a nurse, we're in a unique position to be able to do that for our patients. And it's one of the coolest things in the world, man. I mean, realistically, like I said, having been in the EMS side of things, you get 15 minutes to interact with someone, and they may or may not even be conscious. With a nurse, you get an entire 12 hours to find out what's going on with this patient. Sometimes it's like combat. You're in the trenches and you're fighting tooth and nail, and you're trying to make sure that they just survive that shift. And other times you've got 12 hours where they've already turned the corner. They've already had some sort of definitive care that the treatment has worked, and you get an opportunity just to kind of, work with them to figure out, there's an education aspect of it. There's a social aspect of it. It's one of the coolest things in the world to be able to talk to a patient at the end of their ordeal and, shake their hand, tell them it was a pleasure to meet them, and tell them that you never, ever want to see them again. It's a great gig, man. I really am looking forward to it. As far as a career, I couldn't be happier. Idaho State University realistically was one of the better options in the entire region. I mean, I live here in Caldwell. I'm not exactly an Idaho native. I was born in Colorado, but I live here now, and I don't plan on going anywhere else. And realistically, the accelerated program in particular, being that condensed amount of time, it being at the Meridian campus, was incredibly convenient, especially for me, having already kind of got a couple of professions behind me, already kind of gotten some education behind me. And Idaho State University just had that, it had all of those things that made it work for me. I mean, it wasn't just that the location was convenient. It wasn't just that the timing of it was convenient, but Idaho State University has a great reputation. In the Treasure Valley in particular, there's a few other nursing programs out there. I'm not going to mention any of them, but ISU has that reputation. When we go into our clinicals, when we go into our preceptorships, when you talk to the nurses on the floor, at all of the major anchor hospitals around here, they know ISU. We have that reputation for our nursing students are widely considered to be some of the best students out there. And it's it's nice to kind of walk in with that advantage. I mean, you get the opportunity to see more, you get the opportunity to do more, and your hiring opportunities, which, you know, that's kind of the whole point, right? Your hiring opportunities are just that much better. People know that you graduated from an intense program. They know that you were committed to buckling down and taking 12 months out of your life to, you know, get this, you know, to get this hurdle and to get this certification and to get this education. And I think that it just makes you a better candidate when you get out on the other side and you're looking to hire. I mean, the very first position that I hired for, I got, and it's my dream job. I can't honestly believe that in less than 12 months, I was able to go from, you know, I had a decent career behind me, but now I get to go do what I want to do. I'm basically going to get paid to do something that I would be willing to do for free. That's one of those rare things that, you know, people talk a lot about it and there's always a lot of lip service, but when you find that thing that you're passionate about, and you find, you know, something like Idaho State University, where they are set up in such a way to be able to get you from point A to point B in a way that makes sense, which isn't for everyone. I mean, especially the accelerated program. If you're an adult, you already have a life, you're already established. Man, it's hard. It's really hard to go back to school. It's really hard to go back and retool everything. I know, you know, the idea of the midlife crisis is kind of a cliche, but if you have a year that you can kind of pull everything back, at least, you know, for the accelerated program, that's a huge thing to be able to do that, and, you know, not drop everything in your life. You know, I mean, it's not this huge deal where you're not able to recover from it. You know, and I know that ISU, there's a couple other things that they had. I know they've got their MLS. I think it's the Master of Laboratory Science and some other things. You know, I know that they've got opportunities. You know, if nursing isn't your gig, they've got other options. I also know that, you know, if nursing is your gig, again, there's the NP program that they have. There's the PA program that they have. I mean, there's other things that they've got going on for them. For me, the nursing program was absolutely what I wanted. It's what made the most sense. But, you know, Idaho State University having that reputation, and honestly, you know, the satellite campus up here in Meridian, what a good deal that is. If you can't, you know, drive all the way down to Pocatello, you know, if you're an old guy like me and you don't ever want to live in a dorm again, the Meridian campus is definitely the way to go.